welcome back to Rohrich Knows Podcast, helping you become a better and more informed you. And today we're going to talk about fat grafting. And I can't think of anybody better than a world-renowned Dr. Steve Cohen, a board-certified plastic surgeon in San Diego, to talk about fat grafting. Steve, how are you doing today?
I'm great, Rod. It's great to see you. It's been a long time, I think like a week.
It's been a week, yes. And of course, he's in San Diego. It's always sunny and beautiful in San Diego. So let's talk about fat grafting. And why has fat grafting revolutionized facial cosmetic surgery? It revolutionized all of plastic surgery, but why has fat grafting become so important in facial rejuvenation?
Well, I think through the world of fillers and our understanding of how the face decays, one of the major components is losing facial fat and losing it in specific areas. And the unique thing about facial fat grafting now is it's not like, old style fat grafting. It's kind of a whole new concept because, we're beginning to address facial decay, and we're actually making not only the tissues look better and we look more aesthetically pleasing and more youthful, but we're making the cells younger. Actually, the telomeres are becoming longer. And that's what's exciting to me.
So tell us about, now for the viewer, he's talking about facial decay. It's like we're rotting away. So Steve, tell us a little bit about how our faces decay as we age, and then also tell us about telomeres.
So the way we decay, we grow and develop for the first 22 years of life. And then depending on your internal, external environment, your genetics, your lifestyle, you begin to gradually be affected by changes that occur with aging. And one of the primary changes is losing our fat, and the fat is located both above and below muscle.
Yep.
So it supports the muscle gliding, but it also has huge support functions for the skin. So as we lose fat, we lose stem cells in fat, and then we have an inability to begin to repair the skin that's being injured by sun. So everything is kind of interconnected, but for the patient, they come in and go, I see hollowing, I see deep folds, I've lost my cheek my cheek prominence, and these are the manifestations of lost fat and to some extent lost bone with the aging process.
Right, and of course, it sounds very, very, like an epiphany, and it really is to a certain extent, because fat is a structural support of the face. And until about 20 years ago, we thought it was all just because we basically were losing bone and tissue, and that it was causing, facial skin sagging. But really, it's the fat compartments that are so important, is it not? I mean, that's really provides the structural support of the face. And
yes,
that was an epiphany.
Yeah, exactly, Rod. I couldn't agree more. And what's unique about it is, what we have found very interesting is when we start using our own tissue, we're very much connected to nature. And when people say it's a natural filler, yes, it's a natural filler, but there's so many other implications because the cells that are associated with fat, stem cells, regenerative cells, actually on a cell level communicate with the cells in our face and basically make them more youthful. And hence we look better and we look younger.
Right. And I think the cornerstone of modern facial rejuvenation isn't just lifting the deep layers, and we'll talk a little bit more about that in another podcast, is you have to fill it and then lift it. And I think, you and I have talked a lot about that and how we think that's so important in modern facial rejuvenation.
Absolutely. And, Rod, when I first started, and I think probably the same for you, Tim Martin, a variety of other people that have kind of pioneered this in plastic surgery, it was amazing to go to a meeting and ask for a raise of hands how many people use fat during a facelift.
Right.
And in 2009, I would say maybe 2%, 3% of the audience. And if you said more than 10 milliliters, probably maybe one or two people.
Right.
And who knows if they were even telling the truth. And I was presenting here's an average of 50 milliliters going in, because when you address all segments of loss, what adds up is a substantial amount. And it's been very, very, I can't even think of doing facelifts now without, a lift and fill kind of approach.
Yep. No, I agree. And, when we talked about it and you described it in 2007, the fat compartments, which of course they're all over the face and the body, but basically I think it's the cornerstone of facial rejuvenation, along with lifting the deep layers. And I think that gives you a natural, harmonious facelift. And you're right, Tim Martin, yourself and myself and a few other people really kind of, I think, helped provide that impetus so that people actually not only made it look more natural, but also more youthful, don't you think? I mean,
well, and what's so beautiful about it is the merging of art and science, because this is the science of aging. So instead of going, oh, I look hollow, it's like, yeah, why? I've lost volume. Well, volume's not air. It's not like air in a tire. It's specific tissues.
right.
And as surgeons, we can anatomically identify what those specific tissues are, and we can treat them. And now, instead of just everything is an aesthetic, oh, it looks great, I made your cheeks look like apples, now we're really surgical anatomists that are reconstructing youth. Period. That's what we're actually doing. And that's what I find very exciting. It's not like I'm throwing in a little bit of fat because it looks good. It's a very methodical approach to replacing all areas of loss, stimulating the skin with these cells, and creating even a biocream of fat. And with that protocol, if you're 55 or under, you're going to see an 80% improvement in facial volume if you don't gain a pound, and no matter how much fat I put in 2 years later. Meaning, if your curve of decay, like nuclear decay, is rapid, you just changed it. And now your facial tissue not only looks better, but is going to live longer, and it's going to look better for much longer.
Yep, and you've actually shown that in some beautiful studies. So tell us exactly how you do that. I mean, it's really differential fat grafting, and because fat's different in different parts of the face.
So what I do is I look from top to bottom, and I say, okay, your temples, if they're indented, that is deep temporal fat connected to the buccal fat compartment.
Right.
If it's superficial and veiny, that's superficial fat. If you see the brow down, the brow is down from a combination of not just a two-dimensional drapery, but a three-dimensional loss of retrofrontalis fat. And so we can fix these things. When you begin to look at the cheek, you see the deep medial fat compartment, you see the inner aspect of the fat below the muscle around the eye, the orbicularis, the lateral compartment. And although the malar fat pad is superficial, it's an important component of deep rebuilding. And then you look at the buccal fat, which in my patients, the Caucasian patients, probably 25% start to indent.
Right.
That's not below the skin, that's in the buccal compartment. And you look at the chin and the pre-jowl and whether or not you want to augment the gonial area, and also the piriform, which has an amazing effect of bringing the tip of the nose up and reversing some of the dynamic changes of nasal aging. So, it's a very routine thing. We do this before we do the facelift, but at the same setting. At the very end of the case, after the facelift's done, we microneedle a component of the fat called nanofat, which is the cell component of fat. And then we make a biocream of the cell component, which the patient keeps in the refrigerator, uses till it's gone. And with that routine, again, under 55, 80% improvement 2 years later. If you're older than 55 and you don't do a facelift, just the fat grafting, 20%. Why? Because our cells, we have more senescent cells. We already have cells that are too old to perform the way we need them to perform. But when you combine that with a facelift, 75% improvement in facial volume 2 years later, whether it's repositioning the fat or some other signaling that turns on your stem cells, I'm not sure of, but that's what we see now in prospective studies.
Yep. I mean, that's really, to me, that's the game changer. And yet now, as you mentioned, early on, nobody was doing it. Now I think it's an imperative part of every facelift, and it should be. And And when I see presentations, I mean, a majority are doing face fat transfer with their whatever plain facelift they're doing because the results look better and more natural. And I think that's really, I think, become the gold standard, don't you think?
Totally. And my only bone to pick is I hope surgeons will stop using this as like an add-on throwaway
Exactly.
and make this a very critical part of their procedure because if they do it both scientifically and artistically, their results are going to be better and much longer lasting.
Yep. No, I agree. And I see that in patients that, you know, that you've done, that Tim Martin's done, that I've done, and Jim Stuzen, who actually does it actually at the end of the procedure, they look dramatically better and they look better long term. And I think that's really, I think, become the gold standard. So I think, you know, for patients seeking out facial rejuvenation, I think it's an essential part because now we're just talking about the deep plane, the deep layer, but that is only a component of total facial rejuvenation, don't you think?
Totally. And you know, Rod, for patients, they're always going, well, I heard fat grafting is variable. I heard it doesn't last. And doctors oftentimes, you know, echo sometimes the same comments. And the point is, all of this fat, virtually all of it dies. It functions as a stabilizer. The stem cells survive, and the stabilizers, like an empty apartment house, begins to call in cells from bone marrow and elsewhere. So what happens is, again, in healthy patients, you see a drop down to almost 20% at 4 to 6 months, but 80% by 2 years with no weight gain because it's a regenerative process. It is not what we thought. It's not like a race to get a blood supply. Forget the blood supply. What it is 3 phases. One is the initial phase, and it really functions as a matrix, you know, stabilizing the tissue. A little bit survives from, you know, nutrition and imbibition. And then the second phase is a regenerating phase where the stem cells turn on, there's recruitment, and then the third phase is remodeling. And that's why we see something completely different, more of a multiphasic integrative theory rather than these older theories, which a lot of the equipment being developed to clean the fat and do this and that, they really don't do anything. The best thing they do is condense the fat so you're putting in a more uniform, you know, fat graft. You know, it's not 7 cc's of fat, 3 cc's of fluid, it's 9 cc's of fat consistently. But otherwise, you might as well just say it doesn't even matter other than decanting it and making sure it's ready to go in because it won't matter.
Yep, and I agree. And I think that's an excellent explanation. And yet so many plastic surgeons still don't get it. And because they still talk about, oh, but half the fat's gone in a year. Well, a lot is gone in a year, but you're just in that phase, like you said, at 6 months is when you start seeing it repopulating. It is a matrix. I mean, what does the matrix do? It enhances the stem cells to come in and actually allow for the deep and superficial fat to grow along with your result. And I think that's the key. So Stephen, tell me, what should the patient or our viewers ask when they go to see a facelift surgeon who's talking about all of these aggressive deep plane or any other procedure? What are the key things they should really know and understand if they want to get a good long-term natural looking result?
I think they need to address their sun damage. Everybody gets it. It doesn't matter if you're black, blue, green, white, pink, or multicolored. We all respond to the sun with an injury.
Right.
2, address volume loss more precisely. Don't just throw it in, it looks better in the cheek. Start to think anatomically where it belongs and what's happening to the face as it decays. It's exciting to look at these changes. And 3, to address laxity. So when you are able to address all of these conditions, because that's what causes aging, you're not overcompensating by overfilling, you're not overcompensating by pulling too tight, you're not kind of justifying the skin looks crappy, but everything else looks good because you're not treating the surface. So in my opinion, scientifically addressing what's really happening is really the key.
Yep, I totally agree. I mean, wise words from a wise surgeon, because beauty is more than skin deep. It's the skin, it's the deep layers, the volume loss, And then it's the effect of lifting the deep layers and putting them in harmony to make it look youthful and natural. And we see that, you know, the whole key term in 2025 is invisible. In other words, it looks so good, it looks natural. Those are the best facelifts. The facelifts that look like they've been operated on, like we see in a lot of the quote unquote famous people, that's not a good look and that's not good plastic surgery.
Well, you know what's sad, Rod, is that when we say the new trend is invisible, I'm thinking, since when was that not the trend?
I know that. In fact, I addressed that recently in a short YouTube when somebody asked me, what's the trend for 2025? I say, it's back to the future. It's being,
no kidding,
doing it natural, just like a rhinoplasty. You know, you don't want to look like you've had a rhinoplasty. You don't want to look like you've had a facelift. And we're seeing more and more of that. So wise words from Dr. Steve Cohen, a world expert in facial rejuvenation and a real thinker. So give us your thoughts, give us your comments, and before you go to find your facelift surgeon, make sure they understand the science of aging, like we just talked about with Dr. Cohen. Till next time, stay safe, stay educated. Thank you again, Dr. Cohen.